Through the REACH healthcare program, West Park Hospital is able to gather students from middle schools across Park County and introduce them to a variety of career opportunities in healthcare.
There's a strong demand for healthcare providers, so as you spend your next 4, 5, 6 years in the rest of middle school, high school, trying to assess what you want to do when you go to college, like I say, think about healthcare. There's some wonderful careers. Today, we're excited to have you here, and I just wanted to welcome you and have a great time today, okay?
The day started with Nutritional Services in West Park Hospital's Buffalo Bistro.
So this year at the REACH camp was our first year down in our new cafe. So our new cafe has a bunch of different items. We have a grill, and we also have a fire pizza oven. Our executive chef, Amy, she worked with the kids and helped them make pizzas, kind of went over our daily routines, what we do.
Well, we started out docking the dough and kind of stretching it a little bit, put our sauce on, and then we let them pick the toppings that they wanted on there, and then entered it into the oven and then kind of rotated it through the oven and pulled it out. They cut it and then put whatever toppings they wanted on from there.
Our two dietitians, Liz and Michelle, talked with the kids about what they did, how much schooling they had, how important it was to really go over each menu item that we have and make sure that our residents and patients are getting our their daily values and all the nutritionals. So it's really important to reach the kids, when they're younger, in middle school age, so that way they can kind of focus on, where they want to go when they get into high school. So if you get to them early, they get to kind of explore different areas of what may interest them, and it's anywhere from being an EMT to working in the kitchen as a cook.
After eating their pizzas, the students walked up to the pharmacy department and learned about potential careers in the field, as well as how the pharmacy helps patients both in and outside the hospital. Up next was the Rehab department, where students witnessed the different types of physical rehabilitation West Park Hospital offers.
On the day of the camp, the kids came in and we separated them into 2 groups. We explained to them what therapy is all about, and then we have speech, occupational, and physical therapies. So they used a mechanical lift to work on transferring as if they'd had a CVA, a stroke, and they also used a gait belt with a weighted ball holding it on one side so that they could feel their balance be off center. And a lot of patients that we work with have balance issues, so that was one way they could feel the difference between being balanced and unbalanced in their in standing. Then we also worked on adaptive equipment, how to get socks on and off, how to put a pair of shorts on, especially when they only have one arm available to use, or a weakness in their body and they needed those tools to help them get dressed. Therapy is a lot of fun, and I think the kids enjoyed themselves, and they enjoyed using the different equipment, and hopefully we will gain some therapists in the future.
The students then went down to cardiopulmonary and radiology.
Our involvement with the REACH camp was to give demonstrations of various areas of our department, and their involvement kind of exposed them to what we do on an everyday basis. We set up stations. We had boards up about the history of X-ray in different areas. We presented the campers with a pamphlet with the same thing, a little book for them to reference. Then we took them through, stopped at different stations. We separated into smaller breakout groups. We went through and broke off into ultrasound, CT, and MRI. I think they actually saw that what an image does, how it creates either a 3D rendering or actually a live image like an ultrasound. We showed them how to use the equipment. We showed them how to talked about requirements we have for testing. There were several questions. Several of the kids had been patients before, and so their experience came to life and actually saw it from a different perspective.
The day concluded at the emergency room, where students experienced a stage emergency followed by an ambulance ride with real-time emergency room action. The Reach Camp is a special day that the students and staff will never forget.
I think it's important for students to go through the Reach Camp because it gives them an understanding of what happens in healthcare. And it's not just doctors and nurses. There are other fields that help patients get better and get home and back to their daily lives.
Encourage your kids to come and apply to the program because you get so much out of it, because you get to see all the different areas in the hospital and, clinical, non-clinical. You get to see what they do on a daily basis, and getting your kid immersed in that atmosphere at a young age is, I think, really important.
We have an aging group of employees here, a lot of tenure, so having these individuals come through, these kids come through, I think has helped possibly a future career choice for them and maybe recruiting. The other part of it is that it also gives our staff a chance to be involved on a different level of patient care with teaching, and that's important.
Well, we're always going to need doctors and dietitians and nurses, so there's always positions open in the hospital for that. So getting kids immersed in that at a young age, I think is really, really important. And I think West Park Hospital values that and looks for that in the community that we have.